Now moving towards another important anatomic factor, which is intra-radicular dimension, degree of separation of roots. It is very important for the treatment planning because many of the roots are either approximated or fused roots. They actually basically causes difficulty in adequate instrumentation either during scaling, root planning or surgery. So the teeth which are widely separated have more treatment options as compared those teeth that their roots are fused or there is not enough separation. Anatomy of furcation. Anatomy of furcation is very complex. In the presence of bifurcational ridges or a concavity in the dome, there is possible accessory canals complicates not only scaling but also root planning, surgical therapy. So periodontal maintenance is important. And odontoplasty, which is a treatment, is done to reduce either or eliminate these ridges that actually cause difficulty in scaling, root planning or surgical therapy. Okay, that may be required during surgical therapy for an optional result. Now you can see here in first diagram the roots are widely separated. In second diagram the roots are less separated but close. They are actually close fuse roots, but only in the apical portion there has been separation and presence of enamel projection that may be conductive in choice of into early furcation involvement. Then moving towards the cervical enamel projections, these are reported in 8.86% to 28.6% of molars. The prevalence is highest for the mandibular and maxillary second molars. Means okay. Then you have classification of this. According to this, we do the treatment. The projection can affect the plaque remover, which is complicate the scaling, root planning, and may be a local factor in development of gingivitis or periodontitis. Okay. But if you resolve this, so it can facilitate the maintenance. Like classification of cervical enamel projection. In grade 1, the enamel projection is extended to the cemento-enamel junction of the tooth towards the furcation entrance. In second grade, the enamel projection approaches the entrance to a furcation, but it does not enter the furcation and therefore no horizontal component is present. Grade 3, the enamel projection extends horizontally into the furcation area. It is like this. This is the cervical enamel projection is actually. Now, basically we will discuss the anatomy of the bony lesions like pattern of attachment loss. So basically they are saying that furcation is very important because it is associated with bony lesions. Horizontal bone loss, basically it exposes a furcation, and in this you have lingual and facial plates are thin. They are they are also totally lost during resorption, but areas with thick bony ridges, okay, may persist and predispose to a development of furcation with deep vertical components, means when there is a vertical bone loss. So what happened? The pattern of bone loss on other side of effective tooth and also an adjustment can be considered. Means when you are treating the furcation, so you have to also consider consider the effect of tooth, but also the tooth which is adjacent to it, you will consider that tooth also for the treatment purposes. The treatment response in deep multi-walled bony defects, like you have one wall defect, two wall defect or three wall defects, is different from areas of horizontal bone loss. They are complex. There is a complex in the treatment in the multi-wall defects with deep intra-radicular vertical components, that is candidates for regenerative therapies. Molars, basically molars with their advanced attachment loss on only one root may be treated for resective procedures. We will discuss what are resective, but they are saying the molars that have attachment loss on only one root may be treated by resective procedures. Now, basically, what are the Other clinical findings: the dental and periodontal conditions of adjacent tooth must be considered for the treatment, which I have told you actually. So the combination of furcation involvement and root approximation with adjacent teeth represents the same problem that exists in furcation without adequate root separation. So they are saying that the adjacent teeth also represent might be the same problem in furcations with inadequate root separation. They do not have proper root separation. So such findings actually take the removal of mostly severely affected tooth or removal of the roots. The presence of adequate band of gingiva or moderate to deep vestibular will facilitate the surgical procedures. Okay, so you can see the advanced bone loss, furcation involvement, root approximation. On the buccal furcation, you can see it communicates with the distal furcation of maxillary first molar, but also displays an advanced attachment loss on distal root approximation with the mesial root of the maxillary second molar. So the patient with such teeth will have benefit from root resection of the distal buccal root of the first molar or extraction of the molar.